Patient assessment and management medical. Is the scene safe?
Safe.
I have my PPE on. What's the nature of illness?
Trouble breathing, 18-year-old female.
Okay, and how many patients are there?
1.
Okay, so I'm going to request additional EMS, and I'm not going to stabilize the C-spine because this is a patient just having trouble breathing. What's my general impression?
Patient in tripod position.
Okay, so the patient's in a tripod position. The patient is aware. I walked in and they looked up at me. I see them holding themselves up. Ma'am, what's your name?
Maddie.
Okay, the patient's name is Maddie, so she's aware of what's happening right now and she's conscious. What's the patient's chief complaint?
Trouble breathing.
Okay, and are there any apparent life threats?
No.
Okay, there are no life threats and the patient is just having trouble breathing. Okay, I'm going to assess the airway. So, ma'am, I'm going to hold your head up and I'm going to open your mouth and I'm going to check your mouth. Okay, the airway is clear. I'm going to get a non-rebreather mask. I'm going to put the patient on 15 liters per minute of oxygen because they're having trouble breathing right now, so I'm just going to bump it up to the maximum. I'm going to attach my non-rebreather to an oxygen tank, and then I'm going to let the mask fill up, and then I'm going to attach it to the patient snugly. Okay, and then tighten the mask. Okay, now I'm going to assess the patient's circulation. So I'm going to check their pulse. Okay, and now I'm going to assess the patient's skin. The skin seems normal, it looks normal. It's just a little sweaty. This may be because they're having trouble breathing. Okay, and then now I'm going to assess for any major bleeding. So I'm going to look at the patient, I'm going to look at their limbs, I'm going to look at their arms, I'm going to see if there's any major trauma, and there is no major trauma. Okay, so from what I see right now, I'm going to make this patient a priority patient, code 3, because they're having trouble breathing, as you can see. So I'm going to now start taking the patient's history. Ma'am, what was going on when your trouble breathing started?
My neighbor's dog chased me.
Okay. And is there anything that's making you feel better right now? The breathing feel better?
The oxygen.
The oxygen's helping? Okay, that's good. We'll keep you on that for now. And are you experiencing any pain right now?
No.
Okay, so since the patient's not experiencing any pain, I'm not going to ask them about their quality or radiation. So we're just going to skip over that, but I would ask the question if the patient was feeling any pain. So on a scale of 0 to 10, how hard is it to breathe? 0 being it's really easy to breathe, and 10 being it's very difficult to breathe.
6.
It's a 6? Okay, and around what time did the difficulty breathing start?
Like 20 minutes ago.
Okay, and has this ever happened before? Have you ever been running before and you started having trouble breathing?
Yeah.
Okay, so this is a reoccurring issue. Okay, and do you have any allergies, ma'am?
No.
No allergies? Are you on any medication?
I take my inhaler.
Okay, your inhaler, and is it albuterol?
Yeah, albuterol.
Okay, albuterol, okay. And do you have any past medical history?
No.
No past medical history? Okay. And then you use your inhaler for your asthma, correct?
Yeah.
Okay, perfect. And what was your last meal that you had?
Dinosaur chicken nuggets.
Dinosaur chicken nuggets, and how long ago was that?
Like 57 minutes.
57 minutes ago, okay, so, okay, and so, just to make sure that you were just to confirm, you were running away from a dog, and once you were running, you started having difficulty breathing, is that correct?
Yes.
Okay, so now I'm going to take the patient's vitals, I'm going to check their blood pressure. Okay, cool, and I'm going to check their pulse again. Okay, and I'm going to watch their breathing, chest rise and chest fall. Okay, so I got all that noted down. So now I am going to do a more focused assessment. Since they're having a pulmonary issue, they're having difficulty breathing, I'm going to assess their lungs. I'm going to assess for lung sounds. So I'm going to assess their upper lobes by their clavicles. I'm going to assess the middle part of their lungs. Okay, and now I'm going to assess the sides. I'm going to assess the back. Okay, when I assessed the lungs, I heard wheezing, so it seems like the patient is having difficulty breathing. I'm now going to help them take their albuterol. So, ma'am, can I help you take your albuterol?
Yes.
Okay, so so I aided the patient in taking their albuterol. So my field impression of the patient is that they were just suffering from an asthma attack. What I did to help them was I provided them with oxygen via a non-rebreather at 15 liters per minute, and I had helped them with their albuterol. Okay, so now I'm going to be reassessing the patient every 5 minutes because they are a priority patient. They're having difficulty breathing. So I'm going to reassess them every 5 minutes. I'm going to take their vitals. I'm going to keep reassessing their lungs because that's where the breathing issue is. And I'm going to check up with the patient, continue to ask them, is anything getting worse? Is anything feeling better? Are there any new pains arising before we get to the hospital? And so that is how I'm going to be reassessing the patient every 5 minutes, take their vitals, see if the interventions that I've applied are working. If they're getting worse, I'm going to change my intervention. And so that is how I'm going to continue to reassess the patient. So now my report is, this is an 18-year-old female. Her name is Maddie. She's suffering from difficulty breathing. She was running away from a dog, and that's when this event occurred. She does have a past of having difficulty breathing after doing any sort of cardio. She does suffer from asthma. I assisted her with that by providing her oxygen via a non-rebreather at 15 liters per minute, and by helping her take her albuterol. She does not have any allergies, and her last meal was dinosaur chicken nuggets about 57 minutes ago. I took her vitals and her blood pressure. That all was within the normal range, and I'm going to continue to take that as I approach the healthcare facility. Her skin was a little sweaty, but that was my impression is that that's from the running, so that's why her skin was sweaty. Like I said, no allergies. Her only medication is the albuterol. No past history besides asthma, and the dog was the events that led up to it. And so we'll see you in about 15 minutes. Thank you.